Masayang sinalubong ang bagong taon sa iba't ibang parte ng Pilipinas. Pero pagdating ng January 3, sinalubong naman tayo ng biglaang surge ng COVID cases. Year 2022 o year 2022? Ang tinitingnang dahilan, ang Omicron variant ng COVID-19.
Ang Omicron variant, also known as B11529, ito yung latest variant of concern or VOC. And it's the only VOC that we had in 2021 actually. We had 4 in 2020. We had Alpha, Beta, Delta, and Gamma. Just looking at the genetic mutations in this variant, scientists were very worried back in November because it has some mutations found in the previous variants of concerns.
Una itong naitala sa South Africa noong Nobyembre at ngayon talamak na ito sa Estados Unidos at Europa. Mala-tidal wave nga daw sa bilis ng pagkalat ng Omicron na maaari raw bumalot sa mahigit 50 bansa sa Europa.
At this rate, the Institute for Health Metrics and Evaluation forecasts that more than 50% of the population in the region will be infected with Omicron in the next 6 to 8 weeks.
Tidal wave sa impeksyon din kaya ang hatid ng Omicron sa Pilipinas?
Dahil mas transmissible siya, yun ang kanyang downside. A bit of relative upside is mild siya, pero kung sobrang dami, they will overwhelm the hospitals.
More infectious but less deadly raw ang Omicron ayon sa mga naobserbahan na kaso.
Omicron is still sending people to the hospital and Omicron is still killing people. So as compared to the previous variants, Delta and Alpha, yes, it's milder. So it's not mild, it's just milder.
Don't be fooled. Even if we have a virus that causes less severe disease, this virus can affect vulnerable populations.
Pero may mga nagsasabi naman na ang Omicron daw ay maaaring maging hudyat sa pagtatapos ng pandemya.
We have to realize that Omicron is the beginning of the end of the pandemic.
Omicron, hudyat ng pagtatapos ng pandemya? Here's what you need to know. Ayon sa inilabas na report ng W.H.O nitong January 7, naobserbahang mas mabilis ang reproduction rate ng Omicron kumpara sa Delta. Dagdag pa ni Dr. Melvin Sanicas, isang vaccinologist at infectious disease expert, mas maiksi rin ang incubation period bago lumabas ang sintomas.
For Delta, it is around 10 days, but for Omicron, it's only 2 to 3 days. So it is very transmissible.
Pero ano naman ang pinagkaiba ng laman ng Omicron variant sa Delta? Ayon kay Father Nicanor Austriaco, isang molecular biologist, sa loob ng spike protein ng Omicron variant, mayroong 15 mutation kaya't mas mabilis ito kumapit.
Because the variant has a different spike protein, and the spike protein is the key that the virus uses to enter our cells. So because this variant is different, as you can see, it is much more transmissible.
Iba pa rito ang parte ng spike protein na kumakapit sa human cell na mayroong 10 mutations. Samantalang ang Delta, 2 lang ang mutations. Sa Pilipinas, 29 out of 48 patients ang nakitaan ng Omicron variant sa isinagawang genome sequencing noong January 3, 2022. Sa ngayon ay nasa 43 pasyente na ang may Omicron variant sa bansa. Sa kasalukuyan ay Delta pa rin ang dominant variant sa bansa at kumikilos ng mabilis ang Omicron. Sa bilis ng pagkalat ng virus, paano nga ba magiging beginning of the end ang Omicron variant?
So the idea is that over time, viruses become weaker. This is still very controversial po, but the 1918 Spanish flu pandemic seems to support this, and we are hoping that the Omicron variant is part of this pattern.
Pandemic to endemic. Magiging pangkaraniwang sakit na lang ba ito? Ayon sa ilang eksperto, maaaring pinabibilis ng Omicron ang endemicity sa pag-infect ng mas maraming tao para magkaroon ng layer of natural immunity. Let's move 100 years back. Mayroong teorya na tinatawag na viral attenuation sa biology kung saan humihina ang virus habang tumatagal.
So if you go back 100 years po to the 1918 flu pandemic, the beginning of the end of that pandemic was when the flu virus became milder. And so if we follow the pattern of the 1918 flu pandemic, then it is hopeful that this milder version of COVID, which is infecting so many people without killing them, will provide what is called immunological memory po in the populations.
Hip hip, wag daw muna ma-excite.
So the challenge with comparing what we have right now to the 1918 pandemic is the fact that hindi kasi natin alam lahat na nangyari nung time na yun eh. Diba? 100 years ago, there are some records here and there, but we didn't really know what happened.
May pag-aaral ring tinitingnan na pagkakaroon ng power of immunity ng mga dating tinamaan na ng COVID-19 virus.
First of all, your body has memory B cells as well as T cells. So the memory B cells will be reactivated, they will be awakened, they will become awake again. And what we're seeing is that if you have been vaccinated and you have been infected with Omicron, not only do the memory B cells against Omicron wake up and are developed, all the memory B cells against all the other variants of COVID-19 are also awake. So you have what is called super immunity po.
Lumalabas rin na mas mataas ang immunity laban sa Omicron ng taong nabakunahan matapos magkaroon ng COVID. At nagkaroon din ng booster shot sa isang pag-aaral na published in the New England Journal of Medicine. Yun nga lang, kailangan mo muna magka-COVID bago pa ma-reach ang level na ito. Sa Pilipinas, ayon sa Department of Health, tumaas ang daily cases ngunit bumaba naman ang severe at critical cases na maikukumpara noong September 2021. Ang pagbaba umano na ito ay marahil sa pagkakaroon ng bakuna, ngunit mayroon din tayong tinatawag na natural immunity. Kung ang isang tao ay nagkaroon na ng COVID virus infection, magkakaroon ito ng antibodies bilang depensa sa infeksyon. Kaya't sa susunod na pumasok ang virus muli sa katawan ng isang tao, kilala na ito ng katawan natin dahil sa memory B cells. Mayroon ding tinatawag na T cells na pumapatay ng virus sa mga infected cells.
T cells also remember, which is probably why many people with Omicron who have been vaccinated, their illness is very mild po. Because they have the T cells, even though the B cells are not as good, the antibodies are not as good, the T cell memory is very, very good.
B cells sa labas, T cells sa loob. Ngunit babala ng ilang eksperto, huwag umasa sa natural immunity.
So these are the two uncertainties of natural immunity. It's not a given that it will give you immunity. And secondly, if it's too long in the system that your body is not able to cope with it, it harms you.
Isa pa, marami ring kaso ng reinfections o yung mga 2 beses na tinamaan ng COVID. Sa pag-aaral ng Imperial College London COVID-19 Response Team, ang Omicron variant, 5.4 times ang risk for reinfection kumpara sa Delta. Dagdag pa na binabaliwala ng Omicron variant ang immunity na nakukuha sa unang infection o 2 doses ng bakuna. Sa kabi-kabilang mutations ng virus, binabantayan din ang iba pang nadiskubreng COVID variants gaya ng Wh.O, Deltacron o Delmicron SARS-CoV-2.
So Wh.O was first arrived in France 3 months ago. Walang problema diyan. You know, it was not a problem there, so we really don't expect it to be a problem here because Wh.O could not fight Delta, and Omicron is even stronger than Delta.
This actually was reported already even before Omicron. The reason why this made the news more recently kasi the authors just uploaded it recently. And if you notice, hindi naman talaga siya a news besides the fact na sabi na it's concerning because it has so and so mutations. But I don't think this will be a big issue because it was not able to compete against Delta and Omicron. Kumbaga, wala na. Hindi siya natin naririnig. And even in the south of France, most cases are Omicron.
Dahil hindi natutulog ang virus, hindi rin humihinto ang paghahanap ng iba yung solusyon dito. Mayroon na ring mga gamot na aprobado ng Food and Drug Administration, Paxlovid ng Pfizer at ang Molnupiravir ng Merck. Kasalukuyang pinaghahandaan pa ng Department of Health ang procurement ng Pfizer's Paxlovid. Dahil sa mga development na ito, malayo pa nga ba na mapababa ang pandemic to endemic?
And this will only happen when we have a mild form of COVID, and we must have drugs po, molnupiravir and Paxlovid, that we can give to our kababayans who are at home to make sure they do not go to the hospital. And so this is slowly changing po. It should happen more this coming year.
What I'm saying is Omicron will definitely hasten our trajectory to reach that herd immunity, but I don't think it will be the end because it is still killing people.
Matinding hamon sa gobyerno ngayon ang mahigit 30 milyong katao na hindi pa nababakunahan ng first dose ng COVID-19 vaccine sa bansa. Sa ganitong estado, hindi bakuna ang hamon kundi ang pagpapaabot ng bakuna sa vulnerable population.
It is a major significant part of the way out of this pandemic, but it has to be vaccines and all the tools we have.
And if in each city there is a vaccine wall, it's harder and harder for that virus to go to the farmers.
May mga agam-agam pa ngayon na magpahawa na lang para makakuha ng immunity. Pero giit ng DOH, kailangan pigilan ang pagdami ng impeksyon para mapigilan rin ang pagkakaroon ng bagong variant. Walang kasiguraduhan kung kailan nga ba ang beginning of the end of the pandemic. Ang sigurado ay patuloy ang mutation ng virus. Abi Espiritu para sa GMA News.